Dr. Daniel Amen is a psychiatrist, brain imaging expert, best-selling author, and medical director of the Amen Clinics. He has pioneered the use of brain imaging in clinical psychiatric practice and is a noted expert in the field of the brain and behavior. Dr. Amen's breakthrough research and insights provide hope and more effective treatment for millions of people today.
There are many people who are anxious or depressed or obsessive, prone to anger, they have attentional problems, and they thought their problems were all in their head, purely psychological, if you will. In the research that I've done, what we found is that these and many other problems are brain-based problems, and that when we optimize the brain, their lives become better. We often say, change your brain, change your life, and that's what we've seen. Last week I sort of gave you an introduction to the brain, and we started by looking at different brain systems, and we talked about the prefrontal cortex. I was just in court today on a rape case, and this guy hasn't raped one woman, he's probably raped 6. And when he was 8 years old, he was hit in his forehead with a bat, and on his scan he has damage to the front side of his brain. Now, the damage didn't mean he didn't do it, and it didn't mean he's not responsible for it. But when you think of judgment, you should just put that into the equation, because he's someone that could have benefited from a long time ago getting help. Because without the help, he's just, in a way, condemned to keep doing the same bad behavior. Okay, so his supervisor doesn't work. The next part of the brain that we're going to talk about is called the cingulate gyrus. The cingulate gyrus runs right down the middle of your frontal lobes. It is very important. It's actually an older part of the cerebral cortex. And I want you to think of it as the brain's gear shifter, because it allows you to go from thought to thought, move from idea to idea, be flexible, go with the flow. Now, there are a number of different parts of the cingulate gyrus. Looking at the brain from the left side, so to your left is the front side of the brain, to your right is the back side. The posterior cingulate gyrus, and remember we talked about different anatomical terms. Posterior means toward the back. The back part of the cingulate gyrus is becoming a very hot area in neuroscience now, because what we find is that it very well may be involved in intelligence. And it is low very early in Alzheimer's disease. In fact, it's one of the areas of the brain that helps differentiate Alzheimer's disease from other forms of memory problems. In addition, this back part of the brain, probably more than a decade ago, was the part of the brain they were training in neurofeedback. What neurofeedback is where you put electrodes on the scalp, measure electrical activity underneath where you put the electrode, and change it, either raise it or lower it. And they found when they put electrical electrodes over the posterior cingulate gyrus and trained it to work harder, attention went up and intelligence went up. So we think that area of the brain is what we would call an integrator. It helps get memories into long-term storage. We'll learn later on today about the medial temporal lobes, the inside of the temporal lobes, areas you may have heard about called the hippocampus and the amygdala. Well, they're very important in getting memory into long-term storage. So that's like the initial place. But then it goes to the posterior cingulate gyrus and out to storage centers, which we call association centers in the different cortices, which we'll talk about. And if your posterior cingulate gyrus gets hurt, it's really hard to retain information. So the anterior cingulate gyrus, so anterior means toward the front. The anterior cingulate gyrus, we think of that as really involved in shifting attention. The top part, or dorsal, remember dorsal fin means toward top. Top part is involved in thought shifting. The bottom part is involved in emotional shifting. So if you're argumentative and oppositional, the top part's more likely to be hot. If you just can't let something go in your gut, then more likely the bottom part is hot. So the cingulate gyrus. So looking at the front, we think of these as its functions: cognitive flexibility. What do I mean by that? Go with the flow. You know, if something doesn't go your way, it's okay. You can sort of roll with it, learn how to deal with it. So cognitive flexibility, shifting attention, being able to go from thought to thought, move from idea to idea. See options. Be cooperative. And when you can't see options, there's trouble. People who kill themselves do it because they see no out, no options to the problems that they have. So when it works right, you are flexible. When it works too hard, and usually it works too hard due to a deficit in the neurotransmitter serotonin. So we think of serotonin deficiency states as associated with cognitive inflexibility, being rigid, worriers, people who can't let go, people who get stuck on things, same thought in your head over and over. And it can be an obsessive thought. What's an example of an obsessive thought? It's like, I can't get near that table, because if I get near that table has a pair of scissors on it. I can't get near that because if I do, I'll grab the scissors and kill my child. So that's an example of an obsessive thought. Even though this mother has no intention, no desire, no history of ever being violent, she will change her whole behavior to avoid the table. So that's an example of an obsessive thought. Now, they could get stuck on any thought. They could hold grudges. I mean, what's a grudge? You get a bad thought about somebody, I don't like you, and you hold it. And it might not be reasonable at all, because you might decided you didn't like somebody because you had a stomach ache that day and you were just feeling badly. So they hold often unreasonable bad feelings about other people. So I think that racists have a hot cingulate. They have what is basically an irrational, negative opinion about a group of people, can be even a religious group, right? And they won't let it go. You can't talk to them about it. It's not reasonable, if you will. I think religious wars start because of this part of the brain. You know, believe my way. If you don't believe my way, we need to kill you. So they hold grudges. They have obsessive thoughts. They can have compulsive behaviors. What are examples of compulsive behaviors? Eating disorders often have too much activity in this part of the brain. So it's interesting. There's a difference, though, between anorexia and bulimia. You know, anorexics, they may be 5'7" and 85 pounds. When they decide not to eat, they don't eat. Very hot frontal lobe. So cingulate gyrus and the outside of their frontal lobes are very hot. Bulimics, it's a completely different animal. Bulimics, they binge, they eat like thousands of calories at a time, and then they either take laxatives to purge themselves or they make themselves vomit. Bulimia is what we call an impulsive compulsive disorder. So there's elements of both, as opposed to anorexia is much more an obsessive compulsive spectrum disorder. They decide not to do it, they're not going to do it. Bulimics have 3 times the level of ADD, a prefrontal cortex problem, than do anorexics. So that's one example of a compulsion. What other compulsions? Washing your hands. You bet. Other things? Checking locks, checking the door. And one really strange one, when they're driving along, they think they hit somebody. You know, they hear a rock or whatever, and they go back and they check. And they don't check once. They may go back 30 times. So these people are often late to work. Other examples of impulsive-compulsive disorders. This week I read Pete Rose's new book, his autobiography, which is wonderful. I mean, it's a psychiatric textbook. And in it, he describes having attention deficit disorder, being diagnosed with it, and being diagnosed with oppositional defiant disorder. His family history of significant psychopathology. He's very much like his own mother. And he talks about the treatment for compulsive gambling. It's quite a lovely book. If you think about it from a brain science perspective. So obsessions, compulsions, addictions. I mean, if we think about what's an addiction, I need a drink. I need a drink. I need a drink. They get stuck. Or, I have to have some pot to settle myself down. I have to, they can't let go. Can be a sexual addiction. That's another one of what we would call an impulsive-compulsive disorder. I just did a study with one of the world's leaders on sexual addiction. They used my brain system checklist and found that very high incidence, the highest incidence in these people was they had frontal lobe problems, low prefrontal cortex problems. The second one, they had a hot cingulate. Again, impulsive-compulsive disorder. So addictions and people who are oppositional and argumentative. These are the people who say no, even before you finish asking the question. So there's a disorder in childhood, we call it oppositional defiant disorder. It's where they're angry, they're surly, they're mean. But the great clinical question, you should write this down if you see kids. How many times out of 10, when you ask a child to do something, will they do it the first time without arguing or fighting with you? Now, I was curious as to what was normal. So I sent a questionnaire home to 400 families. And the response we got back in kids that did not have psychiatric problems, 7 times out of 10, kids will do what you ask them to do the first time without giving you grief. Nobody does it all the time, except this one in the back. She was easy. But if the parents go, never, not once, it's a problem. And what we find in children who have oppositional defiant disorder, hot cingulates, but it's like no matter what it is you say to them, it bounces off of them. It's like their brain is in a tunnel, and the tunnel has no windows and no doors, and all they can see is what they want to do. And so to get them out of it is very hard. And so on the surface they appear selfish, they're oppositional. It's like they have Teflon over them. It's like no matter what it is you say, it bounces off them. And it's very irritating. And it's not just children that have this problem. You might know a couple of adults who have this. It's like no matter what it is you say, they argue. And you could go, it's a beautiful day today. Not that nice, they'll tell you. It was much nice yesterday. I was in New York last Wednesday and Thursday. The wind chill factor was 30 below. And you would go, whoa, it's cold. And they would go, oh, you haven't seen anything. Last year it was 60 below. And that's sort of the mindset. It's like we can't interact on sort of an equal, consistent basis. Do you think this could impair relationships? No matter what you say, they argue with it. So, the cingulate gyrus, when it works healthy, is also involved in forward thinking and motivation. So when we see that it is damaged in that part, in fact, there's a wonderful paper from the 1950s from two professors at UC Irvine. They talked about damage to the anterior cingulate gyrus. They said it went with low motivation, didn't care. See, when it's hot, you care too much. In fact, you can't let go of what you care about. But when it's low, you don't care. They tended not to talk, so they called it mutism. Very few words would come from them. And they didn't move, so they had lowered physical movement. Usually for us, we see it as too hot. And when it's too hot, we see it in anxiety disorders. You can't let go. Let's think of agoraphobia. Agoraphobia is a person who has panic disorder, and then they don't leave their house because they're worried they're going to have a panic attack. Now, they can have a panic attack for a completely different reason than the cingulate gyrus. But if they have a panic attack and an overactive cingulate, that worry, that repetitive negative worry, is going to put them at home. I had one patient who didn't leave her house for 40 years. It's like, whoa. And she had a daughter who started having a panic disorder who wouldn't drive. And her poor husband, because she worked like 45 minutes away from their house, so the husband would get up early, take her to work, and then get to work. And they lived in the Bay Area where there's lots of traffic. And, I mean, it was just socially a nightmare for this family. So we see it in anxiety disorders. We see it in post-traumatic stress disorder. What's post-traumatic stress disorder? You get traumatized, your brain fires up, and you can't let go of the trauma. You see it over and over and over again. You basically get stuck. And I'm going to show you a very cool clip later on in the course on a case we did with CBS News on post-traumatic stress disorder. Obsessive-compulsive disorders, what do I mean by that? Well, of course, people who have obsessive-compulsive disorder, where they're bothered with obsessional thinking or compulsive thoughts, but there's like a whole range of things. Compulsive gambling is what they think of as an obsessive-compulsive spectrum disorder. Trichotillomania. You know what trichotillomania is? It's hair pulling. People can't stop pulling out their hair. They're playing with it and pulling it. I've treated a couple of kids that look like they were cancer survivors because they're pulling out their own hair. Obsessive-compulsive spectrum disorder. Tourette syndrome, where people who have tics, both motor tics and vocal tics. Did you know that people with Tourette syndrome, 50% of them have obsessive-compulsive disorder? And more than 50% of them have attention deficit disorder. So this is one of those disorders that teach us how ADD and OCD are really related disorders, even though on the surface it appears as if they are opposite disorders. You know, can't pay attention versus you can't stop paying attention. We see it in eating disorders, as we talked about, addictions and oppositional defiant disorder. We often see it in our violent group, in our study of violent individuals. Many of them, about 2/3 of them, had overactivity in this part of the brain. And if you think about it, these are the people who can't let go. So, you want to break up with me? I don't think so. And so they may stalk you. And last week in Brain in the News, I wrote about this guy from, where's he from? Georgia, whose wife divorced him, and she went off to Oregon to spend some time with her boyfriend, and he went and murdered his in-laws, murdered his 10-month-old baby, and then took the other three kids in the car with him. Those kids have PTSD now, and he got caught, and he shot himself. Now, you know, if somebody's going to divorce me, I'm going to say bye. You know, I feel badly. You know, I know that's not what God wants for me, but see ya. They can't let go. I mean, and they'll give up their very lives because their brain has no windows, has no doors, sees no options to their behavior. So, this is an example of a healthy scan on the left. Someone who has a very hot cingulate who has obsessive compulsive disorder on the right. Somebody who has road rage. Ever met anybody with road rage? Of course, you live in Southern California. The reason that I have a clinic in Northern California is because the road rage in Southern California. I was stationed at Fort Irwin. You know where Fort Irwin is? It's in the Mojave Desert, 40 miles north of Barstow. 1989, I'm ready to get out of the military, and I grew up in Southern California. This is home for me. And one night on the way from Barstow to Corona del Mar, I got chased. I had my kids in the car. I got chased by some wacko on the freeway for about 20 miles, and it scared the socks off me. And I don't know if you remember, around 1989 were all the freeway shootings. They had cartoons and, you know, Los Angeles Times. You know, it's like the old couple with the bazooka. It's like, cover me, honey, I'm going to pass the Toyota. And I just went, there are like way too many crazy people here. Let me go to Northern California where people are normal. They have the same problems. In fact, this is a guy from Northern California. This is an orthopedic surgeon. And the orthopedic surgeon used to chase people on the freeway with his big black BMW. And on this one occasion, a 25-year-old kid, probably a kid who had ADD, cut him off. And so he chases him 8 miles west on Interstate 80. And he corners him on an off-ramp outside of Berkeley. Now, you know, orthopedic surgeons sometimes put metal rods in your legs if you break them. Well, he had one of the metal rods in his car. And so as he cornered this guy, he got out of his car with the metal rod and bashed the kid's windshield in. And what he didn't know is as he was chasing this kid, the California Highway Patrol officer was chasing him. And so he gets arrested at the scene. And from jail, he calls my clinic. And why did he call my clinic? Because we were seeing his sister for anxiety and depression with obsessive features. These things run in families. You're thinking, where do people get this? From their mother. Or from their father. I got mine from my father. I was dying to scan him. He didn't let me scan him for 12 years, but I got him last year. Oh my goodness. No matter what question you ask him, he starts with no. No matter what. And I was looking at his scan and I said, you know, why do you do that? He said it's just easier that way. If somebody really wants something, they have to make their case. Difficult if you're growing up with that, because, you know, I should have been a lawyer, I suppose. Anyways, if you look at this scan, the pencil in the front, so to the left, shows a dramatically overactive cingulate gyrus. So what does that mean? He gets stuck. See, if somebody cuts me up on the freeway, I think to myself, you idiot, and then I leave it alone. Why? Because they're really crazy people out there. There are lots of bad brains. These people, somebody cuts them off, and it's like, you idiot, you idiot, you idiot. And they can't get it out of their head. And they end up doing something crazy or stupid to get it out of their head. I don't know if anybody here believes in PMS besides me. I have 5 sisters. So when women started telling me, you know, I'm not myself, I believed them. You know, those 10 days before the onset of their menstrual period. And I was treating a 15-year-old girl, and one day on a Sunday, I got called. I was actually taking my children to an amusement park, and here I am, all the pinball machines around, and I'm talking to this woman. She said, Dr. Amen, I'm in real trouble. I said, what happened? She said, I tried to kill my husband. Oh, what do you say to that? I'm sorry, you know, I don't know. I said, what happened? She said, you know, he just upset me for a little reason, and I went off and attacked him with a knife. I said, I'll meet you in my office in an hour. And so I went to see her on this Sunday, and she was just weeping. She had left him 3 other times, all within the 10 days before the onset of her menstrual period. So the next day we scanned her. And what we found, cingulate gyrus from hell. Things didn't go her way. But what we also saw, a hot cingulate and a cold frontal lobe. And I'm like, this is not a good picture here. And then we scanned her a week later, after she started her menstrual period and felt more herself. And so we did a study on PMS. It's the first time I ever really believed in multiple personality disorder. And what we know is as estrogen levels change, estrogen is really like an SSRI. Estrogen works like Prozac. And so when you go through low estrogen states, like right before the onset of your menstrual period, or as you're beginning to go through puberty, or after you have a baby, or when you go through menopause, the incidence of depression skyrockets, and obsessiveness. So have empathy for the women who tell you their lives are very different. There's been some studies about women who go to jail, and they commit their crimes much more likely in that 10-day window before the onset of their menstrual period. So it's just something to think about. This is a little boy who came to see me from Iowa. They had read my book, Change Your Brain, Change Your Life, and he walked into my office in Northern California with a Jelly Belly hat on. My clinic in Northern California is in one of the prettiest places in the world. It's 10 miles from downtown Napa, and it's 2 blocks from the famous Jelly Belly factory, you know, the Jelly Bean factory. And so a lot of our patients, when they come visit us, they go to take the Jelly Belly tour. Well, he comes into my office with his hat on and his cowboy boots, and he sits on my blue leather couch, and he puts his feet up on the couch. And, you know, I'm a child psychiatrist. If you care about your furniture and you're a child psychiatrist, you're in the wrong business. So, I mean, it really didn't bother me, but it horrified his mother. And so she just right away put his feet down. Well, he wanted them up there. And so he put them back up, and she put them down, and he put them up. And 10 times this went on. And I had the diagnosis in him and his mother. And I had not even yet said hello. But just to be thorough, I thought I would ask some questions. And the first thing you do when you have a new client or have a new patient is you do some bonding things with them. And so he had a Jelly Belly hat on. I went, how'd you like the Jelly Belly tour? I hated the Jelly Belly tour. And I'm thinking to myself, nobody hates the Jelly Belly tour. They give you free jelly beans. I hated the Jelly Belly tour. Okay. How do you like California? I hate California. And I'm thinking to myself, you're from Iowa. I've been to Iowa. I spent a month in Iowa one night with 600,000 crickets. But his mother looks at him horrified, and she goes, what do you mean? You said you wanted to move here this morning. He said, I know, but I've changed my mind. And you could just see this chronic, constant negativity and opposition. No matter what I would say to him, he would, in a hostile way, respond. You can't get a dialogue with these kids. They're very, very difficult. And they don't do well with psychotherapy because they argue all the time. They have little insight because their brain is always in its own space. So we scanned him. I sort of thought we would see a hot cingulate. We saw an extraordinarily hot cingulate. And he had a mohawk haircut. And I thought, this is a behavioral mohawk in the brain. One of the ways we use scans is actually to see who will respond to an antidepressant mostly serotonin, or who will need something different. And if you have a scan and you see a hot cingulate, there's literature that suggests that that finding predicts a positive response to an SSRI. There's research from the Rottenberg Institute in Toronto, Canada. Increased anterior cingulate activity predicts a positive response to an SSRI. If you don't have increased activity in the anterior cingulate, odds are you're not a worrier, you don't hold grudges, you're not rigid and inflexible, and in that way we'll use something that raises the neurotransmitter dopamine, like Wellbutrin. So, cingulate, think of a serotonin intervention. This is Gary Larson on cingulate marriages. It's 3 Bs in the Hive Counseling Center, and the wife bee says to the therapist bee, listen, I've tried to communicate with him, but he's like a broken record. None of your beeswax, none of your beeswax. And what you see, that's what happens in these marriages, is they just get stuck. They fight. And when we do the part on intimacy later in the course, we're going to talk a lot about this, because the cingulate gyrus causes people to get divorced, because they can't let go of hurts. So in Change Your Brain, Change Your Life, you will notice that there's a whole chapter dedicated to couples. And it's based on a study that I did called the Couples from Hell study. And the Couples from Hell study was based on an original couple I saw in 1991, right when I started doing brain scans. I saw this couple because their 2 kids had ADD. And as I was dealing with the kids, I realized the kids weren't getting better, in large part because mom and dad hated each other. And there was lots of anxiety and tension and slamming doors and threats of divorce, and it wasn't good. And so I thought to myself, well, I'll just see these parents in marriage counseling and fix them. And I was much younger, much more naive than I am now. And I saw them for 9 months. Now, in my office in Northern California, I had 2 blue leather couches. Now, what they hadn't told me, that they told me our first marital therapy session, is they saw 4 other marital therapists. That's usually a bad sign. But in my arrogance, I thought to myself, well, you know, maybe they haven't seen anybody really good. First session, they sat on the opposite end of each couch. This is a very bad sign in marital therapy. This woman, over time, I realized she has a PhD in grudge holding. She beat stuff to death. I mean, from 15 years ago, she was still talking about things. One day, I thought to myself, this woman is going to beat things even in the afterlife. I mean, not just to death, but to beyond the grave, she will still be going at it. And she's married to a guy called the Sniper, because he never paid attention to what was going on. Except when she would sort of settle down and get in a more teachable place, he would say something so evil, so nasty to her, to just like get her going again. And nothing is working. And after about 3 months of seeing these people, I start to develop physical stress symptoms. I see them on my schedule, my stomach hurts. And where I get stress is in the top of my back, it hurts. 6 months, I'm like beyond, because I like it when people get better. It's the big criticism my supervisor in my child psychiatry program said about me. Dr. Amen is a very smart, very loving, caring man, but he wants people to get better fast. It's true. And so at the end of 9 months, I'm getting ready for work, and I'm in my shower, and I realize they're on my schedule, and my stomach starts to hurt. And I'm like, they're in my shower. Today I'm going to tell them to get divorced. I mean, I'd been thinking about it for a long time, and it's something that I've done maybe 5 times in the last 20 years, because I don't like divorce. But the research says that if you're raised in chronic conflict, it is better for you if your parents get divorced, if they can't sort of get better. And so I have this thought in my head because I know the science. Anybody here besides me grow up Roman Catholic? Okay. Well, the Catholics will get what I'm going to say next. So I'm thinking in my head, today I'm going to tell them to get divorced. And then the Catholic voice comes to me. What? Because you're not a good enough therapist? You're going to tell them to get divorced and damn their eternal souls to hell. And I'm just staring at the water faucet. Going, I thought we were beyond this. How much therapy does it take? And so I dried off and got out of the shower, dried off, went over the phone. I called my friend who owned the imaging center. And I said, Jack, I said, would you give me 2 scans for the price of 1? And he said, why? I said, Jack, I have this couple. I don't know what to do with them. They're not getting better. Couple? You want to scan a couple? It's an interesting idea. You know, I've been married twice. I can't figure them out. This could be a whole new business. He said, we could call it brainmatch.com. And I presented it to the couple. And, you know, rather than being argumentative or resistant, they were like, you mean we could get more information? Because if I would have told them to get divorced, they wouldn't have. I was the 5th marital therapist they saw. Obviously, they wanted to be married. And so they were right there with me. And only by chance, if you believe in chance. I read an article the night before in the American Journal of Psychiatry that has been pivotal for me ever since. When we looked at the wife scan, she had the cingulate gyrus from hell. The hottest cingulate I had ever seen. It was 4+. We rate them on a scale of 0 to 4. Hers was 4+. And his brain, when he tried to concentrate, it shut off. And I'm like, ADD children come from ADD parents. How did I miss that? So his ADD was causing him to be conflict-seeking, and she could never let go of anything. So chronic grudge holding with somebody who's always upsetting you is a very bad combination. No one is having much affection in this house. Right? I mean, they hadn't touched each other sexually for 5 years, which I think in a marriage is a bad sign. So I put her on Prozac, and that's the article I read in the Green Journal, that Prozac calms down the cingulate gyrus, which is exactly what we've seen for 13 years. And I put him on Ritalin, and I call this Better Marriage Through Biochemistry. So I want you to start thinking about your couples through the lens of brain science. Okay, so that's the cingulate gyrus, very important part of the brain. We will talk a lot about it. The next part I want us to talk about is the basal ganglia. Basal ganglia are called deep gray matter. Now, gray matter, because it means it's made up of cell bodies. White matter are cell tracts. So they're the axons of cells, if you will. Everybody know what a neuron looks like? Cell body. On one side, bushy tree-like things called dendrites. They are receivers. And then axons that go out from the cell body, usually one, that then gets wrapped in myelin. And when you get a whole bunch of them together, they look like white tracks, if you will. So the basal ganglia, deep gray matter. So it's not on the surface, it's deeper in the brain. And it's made up of a number of different parts. The two that I want you to think about are the caudate nucleus, because it's heavily involved in producing dopamine, and the putamen. And what we know is the caudate is involved in anxious thoughts, and the putamen is more involved with motor behavior. So when you get anxious, you can have bad thoughts in your head. This isn't going to work. I haven't heard from my daughter. She's in a car accident, stuff like that. The putamen is more, when you get anxious, you shake. In fact, it used to be I would never speak in front of a group and hold something in my hand because it would shake. So I always like put it on the table and just be close enough where I could see it, because this is my brain. I show mine because I have the most beautifully hot basal ganglia. So this is another one of mine. I've been scanned like 7 times. The basal ganglia are about integrating feeling and movement, which is why you jump when you get excited. I mean, if you watch, a sporting event, Kobe makes one of those special dunks that he makes. Everybody's like, oh, it's great. This part of the brain is sort of like the conductor of an orchestra. It's also why you freeze when you get scared. Controls your body's idle, how anxious you are. So when it's hot, you feel anxious. When it's cold, you don't care. Modulates anxiety and controls smooth motor movement. And we know when it's a problem in something called Parkinson's disease, where people then start to develop this resting tremor that actually goes away when they do something. When it's increased in activity, people have anxiety. They may have panic attacks. They tend to avoid conflict. They don't deal with the upsetting things in their life, and so they might not talk to their employee that's a problem, and until it's like so bad that they fire them. When it's a much better sort of management technique to, like, if they're not doing well, go talk to them right away. So they avoid conflict. They tend to predict the worst. And sometimes we've seen that they also have excessive motivation. So many of the CEOs of the companies we see have basal ganglia that look like mine. And you would never diagnose them with anything clinical, but they don't go on vacation very much because they sort of like to work. It's sort of like the Energizer Bunny. And they just keep going. And when they do go on vacation, they, say they're getting a massage at a spa or something like that, they're thinking in their mind, I wonder how this spa could make more money. I wonder how they could do this better. It's like their brain never shuts off. When it's really low in activity, they have ADD-like symptoms, lowered motivation. I went to medical school at Oral Roberts University, and I decided, because I went to a small, new medical school, that I wanted to go to a really cool, well-respected program to do my psychiatric training. And so I went to the Walter Reed Army Medical Center in Washington, D.C. But in order to go there, I had to become active duty Army, which was good for me because I was an enlisted soldier during Vietnam. I never went to Vietnam, I went to Germany. But I had a lot of years, and so I got to go to the place I wanted to go, and they paid well. And at the time, I was married and had 2 children, so better than go to UCLA that would pay you $15,000 a year. They paid me $33 or something like that. So they sent me to Fort Sam Houston to learn how to be an officer, which I thought, well, that's fun, because I was an enlisted soldier, and I thought I'd like being an officer much better. But as part of it, they did a lot of physical training courses, and one course we did was a ropes course. And what we had to do in this particular part of the course is we had to go hand over hand on a rope that was attached to a ravine. And the ravine was about 30 yards wide and about 30 yards deep. And below was rocks. But I've always been in pretty good shape. I thought, okay, I can do this. But what they did, not only did you have to go across, they tied us to a seat called a Swiss rope seat, which is where they tie a rope around your waist, put it between your legs, they tie it to you, and then they tie it to the rope. And they say, go out into the middle and let go. And my mind went, we are not doing that. I was 10th out of about 20 guys. And I got out into the middle. Now, all 9 people before me let go. And the rope held them. And then they grabbed on the main rope and, got across. I got out in the middle, and my basal ganglia are so fired up. And I was in great conflict. This is one of the most intense conflictual moments of my whole life. And I went, I don't trust this. But do I be a man and let go? Or do I act like a scared little bunny rabbit and scurry to the other side? And I have to tell you, that day the bunny rabbit won out. I just like can't do this. And I felt so low about myself. Until I got to the other side, I climbed up. My friends had already been laughing at me. I turned around, and one of my close friends, I saw him let go, and they mistied his rope. And he fell 30 feet or whatever it was. And today I can still see him bounce. And he broke his neck, and he punctured his lung, and ruptured his spleen. And, oh. And I have to tell you, from that moment on, I have appreciated my anxiety. Because yes, anxiety can be debilitating, and it can prevent you from doing those things you like in life. But the fact is, we all need some anxiety, right? Because people who have super low levels of anxiety commit more criminal acts. They're not as thoughtful. So it's always a balance. Never pray for all the anxiety to be lifted from your soul. Because then you can drive 150 miles an hour and it won't bother you. But odds are you won't live as long. People who have low activity in their frontal lobes have low anxiety. So, that's my little story. This is a patient who has a panic disorder. And the pencil is pointing to really hot basal ganglia. Someone who has post-traumatic stress disorder. You see that they have a hot cingulate that's toward the top middle, and the basal ganglia are flame. In fact, in PTSD, we have what's called a diamond pattern: hot cingulate, hot basal ganglia, and a hot thalamus, which we will talk about in just a minute. All right, so let's move to what is a very important part of the brain. I mean, they're all very important, but the temporal lobes. The temporal lobes are underneath your temples, behind your eyes. They're very large structures. On the lateral aspect, so now you know that means the outside, they're involved with auditory processing. On the inside, we call it the medial, toward the middle, they're involved with memory and emotional reactions. Emotional reactions we think of as the amygdala, an almond-shaped structure toward the anterior, toward the front, medial, middle, part of the temporal lobes. The hippocampus is right behind it, involved with getting information into short-term memory. In fact, if you hurt your hippocampus, if you have a brain injury and hurt it, you might develop amnesia. And then the whole underside of the temporal lobe is thought to be involved with visual processing and facial recognition. So being able to know this child is yours, or this cat is yours, is very interesting. In fact, there was a report in the 1800s about an Italian man who couldn't recognize his own sheep. Now, how you tell sheep apart, I don't know. But if you're a shepherd, you can tell your sheep apart. And he couldn't anymore. He ended up having a tumor in this part of the brain. So this is looking at the undersurface of the brain. And now there's some differences in lateralization. We'll talk about that later. But the temporal lobes are involved with language. So on the left side, if you're right-handed, they're involved with receptive language, like listening and reading. On the right side, they're more involved with reading social cues, being able to understand and get social situations. They're heavily involved with memory, mood stability, rhythm and music, especially on the right side, and spiritual experience. Isn't that interesting? If you have increased activity in your right temporal lobe, you are more likely to have spiritual or religious experiences. And some of us think you can actually train that in people. Clearly, some people are born with sort of greater ability in that area, but there's things that you can do to train it. We'll talk about a meditation study that we did that actually showed dramatic increased activity in that part of the brain with meditation. So, does that mean, as some neurotheologists would say, it's It's a whole new branch of neuroscience. It's called neurotheology, that the brain makes up God. Well, I think you can say that if you have a small right temporal lobe. That if God's going to talk to us, of course there's going to be parts of the brain that are going to be involved in that communication. So it's interesting. I mean, there's a fascinating book that you might want to pick up. It's called Why Won't God Go Away? And the author is Andrew Newberg. He's a radiologist from the University of Pennsylvania who did SPECT scans like we do on Catholic nuns and Tibetan monks. Now, as far as I know, no one has ever done it, a group speaking in tongues. Now, wouldn't that be interesting? Or people prophesying in church. Wouldn't that be interesting? The problem is you have to sort of subtract the motor movement that would come from speaking in tongues, because that would clearly activate the left front side of the brain, as speech does that. But it would be an interesting study to design. Now, when there are problems in this part of the brain, people have, and that's what you want to be thinking throughout the whole course. This part of the brain does this. If there are problems, often this now becomes a problem. So if the prefrontal cortex is involved with executive function, damage that, you're likely to have executive function problems. The cingulate gyrus helps you with flexibility. Problems there are going to affect flexibility. The temporal lobes are involved with memory, mood stability, temper control, learning. Odds are, if you're going to have a temporal lobe problem, you're going to have problems in those areas, if you will. So, temporal lobe problems, mood instability, memory problems. It's one of the first areas that gets hit in Alzheimer's disease. In fact, when you lose 30% of your hippocampus on the inside part of the temporal lobes, that's when you first start having symptoms of Alzheimer's disease. But isn't that interesting? You can lose up to 30% and not have symptoms. So we use the scans as a way to actually predict who might be at risk and who's not by looking at how much activity is in that part of the brain. So memory problems, feelings of panic or fear for no particular reason, they just come out of the blue. They may be aggressive, and the aggressiveness can be external, I'm going to hurt you, or it may be internal, I'm going to hurt myself. We often see it associated with headaches. Also, you should write this down, tummy aches. There's a condition called abdominal epilepsy. People who have these abdominal pains and nobody can figure out what they are. When you scan them, we often see temporal lobe abnormalities, and if we put them on anti-seizure medicines, their tummy aches get better. They may have periods of déjà vu, you know, the feeling I've been somewhere before even though I never have, or jamais vu, which is, you know, I've been here, but it is not familiar to me at all. It's normal for us to have a little bit of déjà vu in our life. It's not normal to have it happen every day. They also have illusions, where sometimes they see things that aren't there. Now, it's not like a hallucination, like a formed illusion. They may see like what they think of as ghosts, green clouds floating in front of their eyes. They may see things change shape in a picture. I had one guy look at pictures and the figures would move. They may hear things that aren't there, but they won't tell you they hear like formed voices, like hallucinations you'll hear in schizophrenia. It's like, you know, there's the sound of bees buzzing, and I hear that. Or there's static from a radio. Or I hear muffled voices in another room. So if somebody tells you that they hear voices, don't just diagnose them with schizophrenia. It could be they have a temporal lobe abnormality, and the treatment is different. They often have learning problems. Now, if it's left side, it would be a language-based learning problem, like reading, or writing, or spelling. Although it was Andrew Jackson who said it is only the dull man that can spell things one way. On the right side, they have what we call nonverbal learning problems, which are usually associated with social skill deficits. When it's too low in activity, we see issues with learning disabilities, some of the dementias like Alzheimer's disease, epilepsy, although epilepsy and seizures are very similar. So seizures can be when it's too low or too high. The SPEC literature says when they're having a seizure at that moment, there's a lot of increased activity, but in between times, they're having low areas of activity. Aggression can be from brain trauma. The temporal lobes are very easily damaged in trauma because they sit in a part of the skull called the middle cranial fossa, which is surrounded by bone. And so if you get hit here, your temporal lobes have nowhere to go, so they slam against the front and back part of that cavity. When there's too much activity, seizures, mysticism, sometimes spiritual or religious experiences, and through some research we've been doing, we're beginning to think that trauma, emotional trauma, is housed in the right temporal lobe. And that when we treat it effectively, it seems to calm it down a little bit. But isn't that associated with spirituality? But isn't post-traumatic stress disorder really a spiritual crisis? Where you sort of have the idea that the world is safe and that we're protected. And then you get raped. And now you can't even go out of your house because your whole perspective is changed. Or I have the idea that my car is safe and the freeways are safe. But if I got into an accident, now I'm anxious and couldn't drive. I mean, it's like my whole world has changed. This is what brain trauma looks like when it affects the temporal lobes. This is a woman who was sitting in her Volvo outside of Oakland and was rear-ended by an 18-wheel truck. Now, interestingly, her head never hit anything. Can you have a brain injury and your head never hit anything? You bet. Why? Because of the force that happens when you have a whiplash accident. We know this shaking baby syndrome. You take a baby, the reason you shouldn't shake them is because you're shaking and damaging their brain. Plus, it's not good for their joints, and you're scaring them, which is going to increase their anxiety level. It's a little boy who had temporal lobe epilepsy. He used to see his mother's head get really big, and then would see it get really small. Had many illusions as well. He was a very aggressive child. Another person who had epilepsy. It's one of my patients who was arrested for felony domestic violence. He was in a diving accident, and when we looked at his brain, he had frontal lobe problems and severe temporal lobe problems. He just wept when he came to see us. He hated himself. And on his medicine, plus he was in therapy twice a week, just dramatically better, and this is his brain 2 years after treatment. That's why I called the book Change Your Brain, Change Your Life, because you can change this stuff. Alzheimer's disease affects the temporal lobes and the parietal lobes. This is looking down from the top. We'll talk about the parietal lobes in a little bit. Just want to tell you about Kip Kinkle. We'll talk about him later in the course as well. 15-year-old boy in Springfield, Oregon, who was diagnosed with ADD, depression, and dyslexia. He was put on Prozac, made him dramatically worse. He was then put on Ritalin and made him dramatically worse. And what happens if you don't get the medicine right fairly quickly? People don't come back. And they didn't bring him back, and then he brought multiple weapons to school. And he got arrested, and sometime, this was April 1998, sometime between 6 o'clock that night when his mom and dad picked him up, and 8 o'clock the next morning, he murders his mom and dad. And then he went to Thurston High School in Springfield, Oregon, and shot 22 people. So he was one of the early school shooters. As part of his trial, based on my work, they scanned him at Oregon Health Sciences University, and then they sent me the scan, and he had a severe deficit in the left front of his temporal lobe. I mean, it was dramatically abnormal. And if somebody would have seen this up front, they'd have put him on an anti-seizure medicine rather than things that tend to irritate the temporal lobes. This is Andrew. Andrew is a 9-year-old boy. Goodness, it's 9 years ago. Yeah, 9 years ago. He was 9 years old, and he's my nephew. He's also my godson. I got a call at 10:30 one night from his mother, my sister-in-law, who said Andrew had attacked a little girl on the baseball field that day for no apparent reason and hurt her and didn't remember doing it. And I'm like, wow. I said, could you bring him to my office tomorrow? And they drove 8 hours to see me, because I was in Northern California then. And I looked at Andrew, I said, buddy, what's the matter? He said, I don't know. He said, Uncle Danny, I'm mad all the time. I said, is anybody hurting you? No. Anybody teasing you? No. Is anybody touching you in places they shouldn't be touching you? No. I don't know. And I had an advantage with this child that I usually don't have, is that I knew his mom and dad. They're really wonderful people. You know, so I had sort of an understanding of the social piece. My first thought was, scan him. My second thought, because this is 1995, I've been scanning people for 4 years, the level of criticism I got from my colleagues was so high. I actually got investigated by the California Medical Board for a whole year. That was fun. But I stopped talking about this because I already told you I tend to be anxious. I tend to like people to like me. And when I have like lots of people upset with me, it wasn't fun. And so my first thought was to scan him. My second thought was, you want to scan everybody. And so, I was doing this internal dialogue until finally my brain just went, my supervisor went, stop it! Scan him! He's attacked somebody for no particular reason. He doesn't remember doing it. He has a temporal lobe problem. I mean, I'd already scanned lots and lots of people by 1995. And so I went with him and held his hand. And this is the image that came up on the computer screen. He's virtually missing his left temporal lobe. I'd never seen it before. And what we found is he had a cyst the size of a golf ball occupying the space of his temporal lobe. And I called his pediatrician in Orange, and I said, you find somebody to take that out. And he talked to 3 neurologists, all of whom said they wouldn't touch the cyst, and they didn't think the cyst was related to his behavior. At which point, I'm nearly psychotic, because I'd seen lots and lots of violent kids, and I knew exactly what was causing his behavior. And what his sister had told me is that Andrew was drawing pictures of himself shooting other children. And he drew other pictures of himself hanging from a tree. So, I mean, it all fit together very nicely for me. Aggression, internal, external, memory problems. He was having learning problems in school, especially with reading. And so I finally thought to myself, neurologists. Neurosurgeons. Neurosurgeons do things, like they cut things out. And so I called the pediatric neurosurgeon at UCLA, Jorge Lazareff. You know Dr. Lazareff because he's the neurosurgeon that separated the twins who were joined at the head. Sweet, loving man. And as I told him about Andrew, he said, Dr. Amen, he said, I had 3 other children with left temporal lobe cysts and they were all aggressive. Do you think that has anything to do with it? No kidding. Please. Take it out. Which he did. And when Andrew woke up from surgery, he smiled at his mother. She told me later he hadn't smiled for a year. Bad thoughts went away. 9 years. I still cry when I tell this story. Because I think about all the people in residential treatment facilities, in jails, and we label them as bad. I mean, I was in court today with this guy, and he's bad. I mean, he's raped 6 women. I mean, it's so easy for us to judge him. But when you look at their brains, many of them are like Andrew. I had a psychologist from South County. She went to one of my lectures and I told this story. She came up at the break crying her eyes. She said, my son is just getting out of jail. Will you evaluate him? I think he's like Andrew, left temporal lobe cyst. We've seen 8 of them. See, I'm less likely to just call somebody bad. And a year later, we were snorkeling in Hawaii, Andrew and I. And when we were done, we went and grabbed something to drink. And he has these huge brown eyes. And he looked at me. I usually don't tell this part of the story, but I think you'll understand it. He looked at me and he said, why do you think that happened to me? I felt so bad, because I sort of knew. Because since that happened, you can't get me to stop talking about this. And it's like, I needed that. He did really, really great for a long time. And then his behavior started to go backwards. The cyst had refilled. They're hard to take care of. And on one of the times that it refilled, and we could sort of tell because he would get sort of negative and surly. Well, at that point, we rescanned him. And now what we had was the cyst had refilled. His whole brain was hot. And so I put him on some medicine. I was very proud of myself because he got like a lot better. And you can look at before medicine and after. We'd really calmed his brain down. I was thinking to myself, you're such a good doctor. And then what we found is, because he was still having learning problems, this is before medicine, this is after. I calmed his brain down too much. So that's actually what we use when we do follow-up scans. And so it helped me sort of balance things for him. All right, so let's go with what just got activated in me, and that's the limbic system, which is the emotional part of the brain. And it often gets triggered if you remember certain things. Like whenever I tell that story, I can cry, and I mean, it just happens right away. If I talk about my grandfather's death, oh my God, I'll just like cry for a baby, so I'm not even going to talk anymore about that. Or certain things will bring me like intense joy, and they have to do with certain memories. So the limbic system technically includes a lot of different structures in the brain. It includes part of the thalamus. Thalamus is deep gray matter right in the center. Thalamus we think of as sort of the sensory gate to the brain. It also includes the hippocampus and the amygdala, part of the medial temporal lobes that we've talked about. It includes the anterior cingulate gyrus, we've talked about. And it includes the underside of the prefrontal cortex. So all of those are technically considered part of the limbic system. Now, the limbic system integrates and gates information, so it allows information in. In fact, if your thalamus works too hard, people have issues with pain. It's like they get on emotional, physical overload very quickly. Set your emotional tone, how happy or sad you are, is heavily involved with bonding. Your ability to connect to other people. Stores highly charged emotional memories, like the one I just shared, is involved with your sense of smell and your libido. The whole perfume industry is like built on this, right? Get the right smell, and someone will be more interested in you. And just as a bonus for taking this class, if you want to make your man more amorous, cook with cinnamon. The scent of cooked cinnamon is a natural aphrodisiac for men. Not that men need much help. The sex organ in men is 2.5 times larger, the one in the brain I'm talking about. 2.5 times larger in men than it is in women. Now, if you're interested in making your woman more amorous, I do lots of research on this. It's not cologne. I actually did a study with women and cologne and vaginal blood flow. Increased vaginal blood flow is a sign of sexual arousal in women. All of the major men's colognes decreased vaginal blood flow. Don't waste your money. And in this study, the one scent that dramatically increased vaginal blood flow was baby powder. But what do women associate to baby powder? Babies. And then they want one. Now, when there are problems in the limbic system, people have problems with their mood. They feel sad, moody, they're negative, they have lowered motivation, they tend to be more socially isolated, and they tend to lose interest in sex. So when it's too low, we really don't know. They may be less reactive because they get less incoming information. When it's too high, they can have problems with depression, with cyclic mood changes. They can have pain or get overloaded with sensations coming in. This is a woman who had severe postpartum depression. Wasn't even taking care of her baby. This is a very common combination of findings that we see. Increased activity in the thalamus, that's what the yellow arrow is pointing to. Increased activity in the anterior cingulate gyrus, so they get stuck. And low activity in the underside of the prefrontal cortex. And what we see, and we will talk about later, depression is not one thing. Depression is a symptom, like chest pain is a symptom, and giving somebody the diagnosis of depression is too simple. Why don't we give people the diagnosis of chest pain? Right, it's not specific. It's a symptom. And the fact is, depression can come from your gut. It's the most common presenting symptom for pancreatic cancer. Depression. It can come if you have hepatitis. It can come if you have low thyroid. It can come with lots of different brain disorders and metabolic disorders. So to just say you're depressed, it really doesn't mean anything except to have this cluster of symptoms. And that's why we need to be more specific, which when we talk about anxiety and depression, we'll actually subtype in them into different categories. What we see in bipolar disorder, now when they're depressed, it's sort of low activity, but a hot thalamus. When they're in a manic phase, everything in their brain is hot. This is Sandy, my first bipolar scan. She had been on lithium, it helped her, she didn't believe she had a problem, she kept going off her medicine and becoming psychotic and spending money, talking fast, not sleeping, and was just a wreck. So I scanned her in a manic phase just to show her she had a brain problem. It was a medical problem. Another example of a bipolar scan. Excessive overall increased activity. Now, when people are in manic phases, they do bad things. You know, they spend money they don't have, they have affairs, they are often extraordinarily impulsive and get into trouble. Okay. A couple more parts of the brain. The parietal lobes, top back part of the brain, they're involved with sensory processing and direction sense. Now, right behind the motor strip, about in the middle of the brain, there's the sensory strip. So the parietal lobes are called the sensory part of the brain. So if I touch you on your left arm, you're actually going to feel it in the right side of your parietal lobe. They're also involved with spatial processing. They see motion. So being able to catch a football or a baseball is being processed in the parietal lobes. So the parietal lobes help you feel where you are in space. So it's called the where pathway to the parietal lobes. The what pathway, the thing that helps you name objects and recognize objects, are the temporal lobes. So the temporal lobes, what we call the what pathway, the parietal lobes, the where pathway. The parietal lobes help you locate objects in space, distinguish between your left and your right. On the left side, it's involved in reading and arithmetic. On the left side, it's also involved in creating maps. On the right side, it's heavily involved in recognizing when you have a problem. When there are problems in the parietal lobes, people have impaired position and direction sense. Parietal lobes go low in Alzheimer's disease. That's when they can't find their way home. It's when they get lost. On the right side, they'll deny that there's a problem. They have trouble seeing movement. Reading, writing, math is a problem. They have poor constructional ability. They'll often have trouble dressing themselves. And we see it in dementia. Interestingly, we also see it in sleep apnea. People who have sleep apnea. Have you heard of sleep apnea? It's where they don't sleep well at night. They snore loudly. They stop breathing in the middle of the night. And they're chronically tired during the day. That actually increases their risk for Alzheimer's disease. So it's a very important reason to get it taken care of. The occipital lobes, back of the brain, it's involved in visual processing. It's involved in sight and color perception, lines and depth. When there are problems there, well, they can have defects in vision or they can be blind. Difficulty identifying colors. They might have hallucinations. There's a type of dementia called Lewy body dementia that goes and targets the occipital lobes, and it often starts with people having visual hallucinations. They may have something called word blindness, which means they can't read or recognize the word. An interesting thing called blind sight, where you can write what you want them to do, and they'll tell you they can't read it. But then they'll go do it. So it's like their conscious awareness does not process the words, but a part of them does, and they will do what they are asked. And then lastly, and maybe a very important part of the future, is the cerebellum. The cerebellum is the back bottom part of the brain. Cerebellum means little brain. Cerebellum has 50% of the brain's neurons. So even though it is only 10% of the volume of the brain, it houses 50% of the brain's neurons. It's involved in motor control, posture and gait. It's heavily involved in executive function because the cerebellum and the prefrontal cortex are connected to each other. In fact, if you damage one, the other one may be damaged. There's this very interesting condition in neurology called crossed cerebellar diaskesis. So the only hard word there is diaskesis, which means low blood flow. Crossed because if I hit you in your left prefrontal cortex and I really damage it, I may actually take out the function of your right cerebellum. So we can actually see it on scans. So that's why if you hurt the cerebellum, people can have issues with judgment. We also see, and this is the important thing, the cerebellum is heavily integrated into cognition, like the clock speed on a computer. Does anybody here remember, like I do, I'm showing my age, but old AT or XT or 286 computers? Do you remember when you would try to pull up an image on one of those computers, and the images would come up line by line by line? Remember that? The new computers, images popped up, right? I mean, intense images that you took with a 5-megapixel camera that are just really beautiful. Well, if you have a damaged cerebellum, it is like you are living with a 286 computer in a Pentium world. And so you have trouble. You have trouble with your coordination, with your walk. That's what gait means. You have slowed thinking. You have 286 thinking. You have slowed speech. Problems with impulsivity and something called poor conditioned learning. It's like you don't learn automatic processes. You know, there are many things that we do that are automatic, like saying hello, right? I mean, it's something you do it 100 times and you sort of figure out eye contact, shake their hand, or somebody, you know, you're close to, give them a hug, and it's easy. If you don't have a healthy cerebellum, it's sort of like you have to think through that all the time. And then you might develop an obsessional need for sameness because you can't do the other things that most people can do automatically. Anybody have an idea what illness goes with that? Where, you know, it's hard for you to have new information or new activities? That's it. It's autism. They often have small cerebellum and hot cingulates. But it's the cerebellum, the sort of speed of processing that's an issue for them. This is someone who is actually, when he was 3 years old, he had a viral encephalitis, so he had a brain infection, and it killed his cerebellum. Yet it didn't kill him. And he had terrible learning, slow speech, slow gait. You ask him a question, it would take him almost a minute to answer you. And, you know, if you look at this picture, the cerebellum's just missing. Now, this is someone who has Asperger's syndrome, which is an autistic spectrum disorder. We will talk more about it later. And what you see in this view, look at the top left picture. It's looking at the underside of the brain. See, the front is really hot. So gold is sort of average activity. White is the hot spots. So it's like the blue and red ones, except it's gold and white. Flaming frontal lobes, really stuck and rigid. But if we look at the cerebellum, in the back bottom part of the brain, it's dramatically small. And so, how do you fix that? Well, one of the things that you do, and one of the things that I'm starting to encourage all of my patients to do, are coordination exercises. That probably doing needlepoint is a good thing, because you're having to be coordinated and do it in a repetitive way. There's a new treatment called the interactive metronome, where you hear the sound of a metronome, you know, as people use in music, and you clap to it. And initially, people have ADD, for example, they're terrible. They can't sort of get the rhythm, if you will. But as they do better with it, their attention and concentration is better. And it's what we think of as a cerebellar treatment. This is a woman who had a cerebellar tumor. She looked like she had ADD. She wasn't ADD. She had a cerebellar tumor. And after the tumor was taken out, she did ever so much better. Now, in the next couple of minutes, I want to talk about two other important things. The differences between men and women, and the differences between your hemispheres. And they're related to each other. I've been interested in this ever since I was a little boy, because like I told you, I have 5 sisters. And interestingly, men actually have about 4% more cells in their brain. Women have more connections in their brain. So it's not better or worse, it's just different. There's a part of the brain called the corpus callosum. The corpus callosum, huge white tracts that connect the sides, the left side and the right side. It's estimated in females that the corpus callosum is a little bit larger. And that so fits with what we know about left and right hemisphere, because women have greater access to both sides of their brain. Men are much more left-brained, if you will. Sort of like on Dragnet, give me the facts. You know, don't want emotion, don't want a lot of the story, don't need the history, just give me the facts. So larger in women, they have greater access to both sides of their brain. Men tend to be more left-sided. Women tend to use both sides more often. So women actually use hunches, which is a right hemisphere phenomenon. The limbic system is larger in women. Means the bonding center is larger in women, and women are primary caretakers for children. There's not one society on the face of the earth where men are primary caretakers, not one. Now, men should do a better job, because when males in nature take care of the young, they live as long as the females. There's a species of monkeys that do it, and penguins do it. So if your husband is not involved, say, hey, it's in your best interest to be involved. Men who are not involved in raising the young die like 15% earlier than males who are. So because the limbic system is larger, bonding is easier for women. They also have a larger nesting instinct. If you go to a woman's apartment, like just pick 100 random women and compare it to 100 random male apartments, where would you rather live? Right? The nest is much more important to women. That is why women get depressed more when they move. Moves often trigger depression in women because they're losing their nest. Because women have a larger limbic system, they have a greater incidence of depression. Depression is the #1 reason why women are hospitalized from the age of 18 to 44 after have a baby. So the #1 medical illness reason that women are hospitalized. Wow. Twice as much as men. But isn't it interesting that even though women are more depressed than men, women actually try to kill themselves 3 times more than men, that men actually are successful 3 times more than women. Because when they decide to do it, it's not a plea for help. They decide to do it. And they use more violent means. Another male-female difference is the parietal lobes. On the left side, it's larger in men, which means men are usually better, not always, but usually better at estimating time, at judging speed, at visualizing objects in 3D, so catching a football, solving math problems. They're better at getting from point A to point B. But because the right side is larger in women, women will ask for directions. Because men tend to be in denial. See, if your husband is in denial, it may have nothing to do with whether or not he wants to be in denial. The right side sort of gets it. We'll talk about that in a minute. We'll talk about it now. All right, left versus right hemisphere. The left side's gotten a bad rap. You know, we think of people who are left brain, we think of them sort of materialistic, uptight, not happy. The left side's responsible for human success. It's more analytical, it's more logical. It helps you sort of reach your goals. The right side is critical, more holistic, gets the big picture of a situation. I mean, obviously you need both sides. So what the research says is the left side is indeed analytical, calculating, communicative. It breaks down complicated patterns into their component parts. It's time sensitive. It sees the details. So if you're at a party and your left hemisphere sees silk and the color red and lace, and the right side puts it together and goes, party dress, right? So you need both. Left side for details, right side to put everything together. The left side is also logical, precise, conceives and executes plans. This is the reason we think men have 4% more cells. There's more gray matter in the left side. So more cell bodies in the left side. And the cells are densely woven and they're closer together. So they're going to see the details of a situation, so they will see the trees. but not necessarily the forest. You need the right side to see the forest. So the right side, holistic, gets the gestalt. The gestalt is sort of the big picture of the situation. It's involved in sensory perception, but it's also the negative side of the brain. The left side is the happy side of the brain. In fact, with depression, it's low activity in the left prefrontal cortex for a lot of people who are depressed. Or if you get a stroke in the left front side of your brain, you have a 60% chance within a year to develop a major depression. So if you're going to fall out of a window, fall on your right side. Because people have right-sided problems, they don't care. They're in denial. There's actually a term for right frontal lobe damage. It's called Witzelsuch, which means addicted to bad jokes. These are people who they walk into your session and they have to start each session with a joke. And I'm thinking, right frontal lobe problem. The right side is more fearful, it's more mournful, more pessimistic, dreamier, involved in recognizing familiar faces, and it works on hunches. Sees patterns at a glance, sees camouflage images against a complex background. What that means, if you go out to your car at night and there's shadows and things like that, it's the right side that sort of helps figure out what in each layer of information you see. The right hemisphere has more white matter, so it has more tracks. The neurons are connected from farther distances, which means it can draw on several different areas at once to give you sort of the big picture. But it also gives you hunches, which are sort of broad, multifaceted, but vague concepts. Just have to tell you a story. My beautiful daughter has these that are amazing. I was interviewing a doctor for our Fairfield clinic, and we had to pick her up. She was in, I don't know, 6th grade or something at school, and I picked her up, and later that night she said, the guy gave me the creeps. I said, what? You just met him. You know, he went to Yale, and, I'm all excited about him. Lose him, Dad. She had nothing to base that on but a feeling. And of course, she's in 6th grade. I didn't hire him. He was the worst doctor I ever hired. Oh my goodness. So when she says things like that, I at least pay attention. Okay. So that's the end of week 2. Questions? Well, sometimes they do. Sometimes they do. About half the time. It depends on your plan. If you have third-party insurance, they tend to cover it. If you have managed care, they tend not to cover it. And it depends how you order it. If you say we're looking for ADD, they'll go, oh no, ADD is a behavioral problem. They don't think of it as a medical problem. And so they won't cover it. So when we bill it as a frontal lobe problem, which is a different way of saying the same thing. And I think we're being honest both ways. It's just that's what we're looking for. So sometimes it does. Depakote is an anti-seizure medicine. So the question is, in the book, where I wasn't talking about this one, I was talking about another case, where when she was in that bad time of her cycle, her temporal lobe was very abnormal. And what Depakote does is it helps to stabilize activity in the temporal lobes so their mood is more level, more even. So as we will talk about as we get through the course, anxiety and depression are not one thing. PMS is not one thing. Sometimes women, right before their period, they can't let go. Worry, hold on to things don't go their way, they explode. Okay? That responds better to medicines like Prozac because Prozac calms down the cingulate gyrus. Or it could be they explode for little or no reason. It's not cingulate at all. And at that time, the anti-seizure medicines like Depakote work really well. That's a really great question. I'm not really seeing a difference. But when you're overweight, you have obviously more fat cells. and fat cells can harbor toxic material. And so we think there's more brain toxicity that happens with people who are overweight. So it ties in very nicely. People who have temporal lobe pathology, seizures, strokes, tumors in this part of the brain, can have more spiritual experiences. Do have, I mean, according to some pretty interesting research. Now, if the abnormality's on the right, you're going to have a different level of experience than if it's on the left. Often connected. The question was, is there a connection between the deep limbic system and the basal ganglia? You bet. You get diagnosed with depression, 70% of the time you also have an anxiety disorder.